Hello, everyone. My name is Maddy Boehme. I am Vice President of the Hashimoto's Encephalopathy SREAT Alliance, and I'm here today with Dr. Robert Weir. He's a neuropsychiatrist at UT Southwestern Medical Center in Dallas, Texas, and a HESA board member. And he will be answering your top questions and concerns surrounding COVID-19 and autoimmune encephalopathy and encephalitis. So welcome, Dr. Weir, and thank you so much for interviewing with me today.
Thanks, Betty. It's my pleasure to be here. I just briefly, before we get started, want to say that the things I share today are my own opinions and not meant to represent UT Southwestern or any other institution. Also, this is not official medical advice as in coming to a physician. So obviously, if there are very specific things you need to know, as you'll hear me say a few times, talking to your personal physician is important. But what I'm hoping to do is give more general concepts, ideas, and answer some questions to try to help hopefully curb some of the fear and uncertainty that comes with something like this.
Yes, and we super appreciate that of you. So thank you very much. So before we get started to the questions, can you explain to us, from as best as you understand, what the coronavirus is, how it affects the body, and how it's different from a typical virus?
Sure. So when we say coronavirus, we're talking about is the novel coronavirus, meaning this is a new type of coronavirus. It's actually being called COVID-19, which a lot of people hear for corona, co, virus, vi, disease, d. So there's the COVID, and then 19 for the year 2019. So it's a virus that's part of a family of viruses called the coronavirus family. So it's not one virus called a coronavirus, but this is the newest one. So COVID-19, or the novel coronavirus, it's this family of viruses, the coronavirus family, are known for causing respiratory infections. So things all the way from simple colds, like the common cold, all the way to, if people remember SARS, the severe acute respiratory syndrome from 2003, that was also in the coronavirus family. So that's a little bit of background on this virus. It seems to kind of have some of those common respiratory symptoms, and the most common symptoms that we're seeing with COVID-19 are fever, dry cough, fatigue, and shortness of breath. Other people may end up either feeling like their nose is congested or runny. They might have achy muscles or some diarrhea, but fever is very common. I think that's actually the most common, maybe in about 90% of cases. Some people might actually not notice feeling poorly. They might either think they're fine, or they might have very mild symptoms, but you can still actually be contagious even if you do have mild symptoms. So even if you're feeling okay, if you notice those sorts of symptoms, it's best to try to distance yourself from others especially who might be vulnerable. Some of those people who might be vulnerable are older population, people 65 and older especially, people with underlying medical conditions like high blood pressure, heart disease, asthma, diabetes, and certainly we'll get more into people who have autoimmune conditions as well, being probably able to be put into that group of higher risk people. With COVID-19, we're seeing about 1 in 6 people are getting serious illness that might get all the way to requiring oxygen in the hospital, which would just be like a little mask on their face. And about 1 in 20 people are needing to actually go to an intensive care unit where they may get put on a ventilator. So, if somebody notices they're having trouble breathing, chest pain that won't go away, a new confusion that came out of nowhere, feeling really sluggish, or blue lips or blue face, those are all kind of more concerning signs that say we should call 911 right now. In general, I would say, if we were talking 2 months ago, I would say call 911 or go to the ER. But actually, the emergency room might not be the safest place to go right now. And that's not to tell people not to seek emergent care. So don't think I'm not saying that. What I'm saying, you might call 911 to find out if they could come and, either get you and transport you, or find a way that you're not sitting around a bunch of other people. That's all I'm trying to say, is that just being cautious about the kind of contacts we're getting.
Yes, it's best to call ahead of time to see and get instructions on where to go and what to do.
That's exactly right. And to continue a little bit more about the virus, it as I said, affects older people disproportionately, but it doesn't mean that younger people are safe. I saw early studies in the United States showed that 1 in 5 or so people who were 20 to 44 years old actually had required hospitalization.
Oh, wow.
So that's quite a bit. And although it looks like children are generally not as affected by it, the children that tend to be more affected are actually the very little ones, infants and toddlers. But we're just getting more data, and that's going to be a theme as we talk, is that the data is limited because this is so new, and we're, as medical professionals, we're trying to gather the data and trying to distribute the data as quickly as we can, but we have to make sure it's right. But in general, kids have been doing pretty well, and older people, especially 65 plus, have not. I do briefly want to mention some of the things that people probably have heard, and if they haven't, hopefully they will be writing these down or remembering them for later, as the ways to kind of protect ourselves and others. And those include things like washing hands vigorously with soap and water for 20 seconds or longer. One easy way to do that is sing the happy birthday song to yourself 2 times in a row. Wash your hands more frequently than usual, such as, say you're coming home from somewhere, maybe do it when you get in the door so you're not bringing outside germs inside. If you have to cough, cough into the crook of your elbow, not into your hand. If you have to wipe your nose, don't wipe your hand with it. And then similarly, try not to touch your face. That's one of the hard things for a lot of people right now. Or if you gotta touch your face, make sure your hands are clean. I've actually had people tell me their faces feel itchier right now than they ever have.
It's that what you can't do, you want to do so bad.
Exactly right. And then people should also be avoiding contact with elderly and sick people as much as possible. You also kind of asked me what's different with this in seasonal influenza, right? So they can kind of look similar up front. And they can have similar transmissions. So one type of transmission is called contact, right? So that's like touching. So if you touch someone who has that on them, or when you're touching your face, those things we're talking about, you could get it. Another is droplet, meaning if I cough forcefully, little droplets might come out and cause it, but usually not just breathing in your direction. So it's not something like that. It's more like these little particle droplets, which is why we talk about coughing in the elbow, things like that. What's really different with this and influenza, the seasonal influenza virus, is that influenza has this shorter period of what we call incubation, meaning from the time you get infected to the time symptoms show is usually about 3 days. With COVID-19, it can be closer to a week. So it's a little bit longer. So it may take several days before someone even knows that they are now, infected. The other very concerning thing is that there's a much higher proportion of COVID-19 infections that are more serious. It appears to be probably at least 10 times more lethal than the seasonal influenza.
Wow. Yeah, that's a little scary, especially with that period of time where you could have it and you don't know that you have it, and then you go into contact with other people, and it seems to be that what is the main issue with this virus, is that sometimes you just don't know that you have it, or some people are very asymptomatic, and that seems to be fueling the fire and the spread a little bit.
Absolutely.
So yeah, great advice surrounding what you can do to protect yourself. So kind of switching over to more of the autoimmune encephalitis community. So yeah, you said that this can affect more vulnerable populations, which include people who have underlying conditions, kind of like, autoimmune encephalitis or other autoimmune conditions as well. We got a couple questions here from our HESA groups. And so we're going to go through just a couple questions that people had. for you specifically. So the first
Sure.
one on our list here is, I just finished 3 days of my first round of Ivig on Friday. So because that is immune suppressing, does that make me higher risk?
Okay. Good question. So if I can actually first kind of maybe say a few general things about the AE/HE community and COVID, and then I'll transition to that specific question if you don't mind.
Yes. Yeah, that's good.
So I would consider the autoimmune encephalitis or, infectious encephalitis, anyone who's struggling with one of these medical conditions, especially if it's something that's ongoing, meaning it's not just an isolated event in the past. If someone has an ongoing illness, that's more at-risk population, right? That makes sense.
Yes. Yeah.
But we have limited data on this, but someone with an autoimmune condition may be at more risk. And what we probably can guess based on what we know about other areas of medicine is that being immunosuppressed, such as being on things like steroids or rituximab or other like chemotherapeutic agents, could possibly increase the risk of either contracting the virus or having worse symptoms of infection. Again, this isn't validated, but because it's also new, but that is kind of makes a lot of sense.
Yes. Yeah.
So what that's going to translate to for our AE/HE community, I think I just am a big fan of erring on the side of caution, right? So taking up these social distancing policies, following the hygiene recommendations like I shared earlier, and making sure the people that you're in close contact with are also doing the same thing.
Yes.
And then it's important to make sure to contact your physician as soon as you're able to find out if they have any specific recommendations for you if you have any concerns. You don't have to call them if you're already doing these sorts of things and you're feeling okay. I would say if there are upcoming medical appointments that aren't urgent or emergent, it might even be worth talking to your doc and see if they're moving to virtual visits or things like that. I know for myself, we're actually doing virtual encounters for my patients. And so that's a great way to still get the care you need without any additional exposures.
Yes.
To this person who asked about their IVIG. So as I mentioned, kind of the AE/HE group and being immunosuppressed may increase risk. But again, our data is limited.
Yes.
Interestingly though, there are actually some trials right now, I think in China, that even are trying to see if IVIG and steroids may help with symptoms of COVID. So right now, the jury is out. I would say again, until we know more, it's not going to be harmful to err on the side of caution.
Yes. Speaking from my own personal experience, because I'm on IVIG, I have heard at least that IVIG is actually sort of working in your favor in this situation versus something like rituximab or steroids or any of those classification of drugs are working more against you. At least that's just what I've heard about IVIG, but I didn't know if you could comment on that or not.
Yeah, again, even though we can make really educated guesses based on our background and what we know, I hate to make a broad recommendation based on that, but I would be able to say that in general, steroids and rituximab, things like that really suppress the immune system more. IVIG is less about immune suppression, whereas the others are more tamping down the immune system so it won't overreact. Those can also mean that your immune system is not going to react as well to invaders.
Yes. Okay. So moving on to the next question, and you kind of already answered this, are HE or AE patients considered high risk?
And yeah, so I would again say yes. And even despite that, though, there are some other things. Some of the data I'm giving might be things that people already know. So hopefully people are already implementing it, but we don't need to be wearing masks if we're feeling well, according to the Center for Disease Control, CDC. They say if you're feeling well, you don't need to be wearing a mask. But if someone with AE or HE is around a family member who's sick, optimally that person's wearing a mask, or even better, I hate to say don't be around your family. Maybe some people think, oh great, that's a great excuse, but try to avoid try to avoid contact with someone who's sick right now, especially with these respiratory symptoms or a fever. In addition, doing things that are always the doctor's recommendation are even bigger now, like eating healthful foods, making sure we're getting enough sleep, and something easier said than done, reducing stress levels. This is an extremely stressful time for people.
Mm-hmm.
And so trying to do things to lower that stress level can actually help our body have a better response kind of to when things like this come around.
Yes.
I guess I didn't mention earlier that some members of the coronavirus we know from the past can stay on surfaces for up to a few days.
Yes.
So
Yes.
if there are surfaces you're around, not necessarily like in your own home if you've been isolated, but if you're out and about and say you're working in a workspace and other people have been around there quite a bit, you can always use disinfectant to kind of sanitize those surfaces. And again, frequent hand washing can be helpful.
Yes, yes. So speaking again more on talking about autoimmune encephalitis patients, is there a possibility that if an AE patient got the coronavirus, it could cause a relapse of those autoimmune encephalitis symptoms?
That's an interesting question. Infections in general have been known to maybe cause relapse of certain autoimmune conditions, but there's not really any evidence as of yet to kind of suggest this with COVID-19.
Mm-hmm. Okay. So speaking about kind of going back to those immune suppressing drugs, what are the pros and cons to coming off of those drugs during this time to better protect yourself?
So I would recommend not changing your medication regimen at all on your own. The immunosuppressant drugs that you're on, if you're concerned about those actively, then the thing to do would be to get in touch with your provider and let them know about these concerns and see if there's some discussion between you and your physician that ultimately, if they recommend coming off of it, then it might be useful, but it could do more harm than good to just take yourself off of one of these medications. So I would really recommend getting a customized plan with your own physician.
Yes. And I'm sure that trying to keep your AE symptoms at bay during this time to avoid having to go to the hospital or having to go to your doctor is probably the best and smartest move in order to avoid getting COVID-19 too, So yes. Let's see. Someone asked, is it true that corticosteroids and immunosuppressive therapies lessen the activation of those immune cells which are responsible for a fever, meaning that patients on immunosuppressive therapy may not develop a fever with COVID-19?
That's correct. So some people who are on steroids might not mount a fever response, which is a great point to make. So even if you don't have a fever, if you're one of these patients on immunosuppression, if you notice that you're having a cough, shortness of breath, fatigue, those things we talked about earlier, it'd be worth contacting your physician, even if you don't have a fever.
That's good. That's something I didn't know for sure. Being on steroids myself, that can lessen, you from having a fever. So someone asked, should I continue to get my IVIG if I have to go to a hospital to get it?
Again, this is one that I would say just call your physician or physician's office to get specific recommendations.
Yes, I would agree with you on that one too. For those of us who have home therapy, that's really helpful during this time. But yeah, if you did have to go to a hospital, it's probably best to contact your local hospital because, things all over the world, some places are worse than others. And so contacting your doctor for best advice is probably the way to go on that situation.
Exactly. And it may be that they have set up infusion clinics in an isolated area so that you wouldn't be exposed to things, and they may still want you to come and continue getting it. So that's why I kind of want to defer that, because it's going to be a case-by-case basis. Some people, it may be that you can go a month or two without it, but some people might need to get it, and they'll find ways to accommodate you.
Mm-hmm. So for those who are not undergoing immunosuppressive therapy, are we at any greater risk than the general population for contracting the virus? And are we at greater risk for developing complications from the virus?
Yeah, so it's kind of a difficult question to answer because every person's different. Some of the things that if you're not struggling with active illness, obviously that is usually a good factor. If you're not on immunosuppression, that's a better prognostic factor. But other things would play into this, like your overall health right now, like how in shape are you? How old are you? And do you have any other medical conditions? So, it's impossible to really give a perfect answer to that because it's a difficult question. But again, I would kind of try to err on the side of caution.
Yes, I think that's a smart move for sure. Can you explain the difference between the term immunocompromised and immunosuppressed?
Sure. Oftentimes, immunocompromised and immunosuppressed can kind of be used interchangeably. But if we're getting a little more technical in the medical world, we tend to say immunocompromised more when we're talking about an individual whose immune system might not work correctly at baseline.
Okay.
Whereas if I say immunosuppressed, it kind of implies that we're actively pushing down the response of the immune system, such as somebody who's on steroids.
Yes. Okay. And this is another more like situation specific question. Can a 20-year-old person with HE who is not treated with immunosuppressive drugs continue to go outside for physical activity?
Also a great question, which brings up some important things. So from what experts are saying so far, going outside is safe. In fact, in my opinion, it's probably even more essential for our mental and physical health right now, especially as we're being increasingly isolated from one another, that we do get time outside and do get some sunlight, of course, with sunscreen on. And when we do that, though, the recommendation would be to go to places that are probably less populated. So if there's a nearby park that doesn't have a lot of people walking in it and you want to go walk there, or even if there are other people that are kind of around, as long as you're keeping at least 6 feet away from those people. As if you see somebody across the way who looks kind of sick, I would avoid going over there. Obviously, these are kind of obvious give me answers, but I think it's important if even one person benefits that we talk about that. But yes. I think ultimately, feel free to run or bike or whatever floats your boat. And that stuff might even be more important right now.
Yes. I know I live out in the country, kind of in the middle of nowhere. And I just went on a walk the other day, and that fresh air and kind of getting out of the house and stuff when you're quarantined just kind of mentally does you some good. So yeah, definitely getting out and about, getting that fresh air is always good for anybody, immune suppressed or not. So are there any extra precautions if we or the medical staff need to take if we test positive for the virus?
If you test positive, well, first I would get in touch with your doctor that actually knows about your autoimmune condition and make sure that they know you're positive, and then that way they can give you specific recommendations. So I would when I say that, I don't just mean any doctor, but whoever it is that's treating you for this AE, HE, or whatever variation thereof, because there might be things that they want you to do that are different than what they would recommend to the general population.
Yes. And so that's kind of the end of our questions that received from our group members. Do you have any more information or advice surrounding COVID-19 that you'd like to share?
Sure, Maddy. I guess just a few more things. We kind of alluded a minute ago to the struggles of being more isolated, and it's already being projected that the nation and even the world's mental health is going to suffer with this big time, whether it's from having loved ones or friends affected by the disease, to just being out of work and having financial woes, to being isolated from each other. Those are all horrible things and very stressful. It is a very stressful time for all of us. And when I'm meeting with patients right now, there's almost no visit I've had that this doesn't come up in some way or another. So I think finding good habits now is important, like trying to create some sort of structure in your home. So my job, for instance, has been very helpful in accommodating us to see patients remotely. So I do a lot of work from home. And so one thing I've done is I try to do a standing desk and do steps at the desk, or when I have a little extra time, kind of walk around. Some people might find mindfulness, meditation, positive, or even just making sure you're away from all electronics and news and all the kind of, the scary buzz that's going on for a few minutes a day. Things like picking up a new hobby could be great right now with all this extra time. Learning a craft or how to crochet or starting a garden or just reading a good book are all great. I also want to mention that when we hear social distancing, I don't love that term because I think what we really should be doing is physical distancing. But socially, we want to be interconnected. So things like right now we're using Zoom or Skype or whatever people can use. Seeing each other is better than just talking to each other, right? Being there and able to hug each other or hold hands, or even seeing somebody smile close by is obviously the best. But while this is the safer thing to do, it's nice to try to be able to have as much contact as we can. So I recommend, making dates still with your friends, and if you don't have a webcam or a phone with FaceTime, then just talk to them on the phone once or twice a week, but really don't let yourself drop off. Another thing on that end is make, as I was saying earlier, kind of make a routine for yourself, because a lot of people getting out of the structure of their day really throws them off. So creating some structure for yourself, it doesn't have to be rigid, but even if it's like, I wake up at this time every day and then I do this and I do this, can help maintain some sense of normality instead of just sitting around in a puddle and feeling horrible. And I kind of mentioned the virtual encounters that I've been doing with patients. You might even ask, your team, or you can even look into getting a therapist or something like that does virtual therapy sessions. These are all, I think, good ideas.
Yeah, absolutely.
And then I guess I would just close by giving people a few resources. So now more than ever, it's important to get good information. There's a lot of misinformation out there. I've heard things like people saying they think smoking is protective against it. It's not. I've heard people say that wearing multiple masks is helpful. There's no evidence to show that. Things like that. So the places to go are the World Health Organization. You can go to who.int. The CDC, like I mentioned earlier, cdc.gov. Local and national, reputable news sources. Then actually another one that might be helpful for this population specifically is ARDA. If you go to www.aarda.org, this is an autoimmune resource group basically. And so they have some statements on COVID-19, and they have links to other places as well. So those would be the top sources that I would look at, especially when we're hearing things from all sorts of sides. The WHO and the CDC are the people we really want to be listening to.
The gold standard.
Exactly.
Yes. Well, thank you so much, Dr. Weir, for taking time to answer our questions, providing great suggestions on how to handle this crazy situation. I think I speak for everyone when we all say that we have no clue what we're doing, because there is no coronavirus handbook that we can just pull out and follow the steps to figure out how to get out of this. So thank you again. For more information, reputable sources, some of the resources that Dr. Weir just talked about, we have posted on our website at hesaonline.info. You can also find more interviews with Dr. Weir on our website as well. I'm Maddy Boehme, and on behalf of the Hashimoto's Encephalopathy SREAT Alliance, everyone, please stay safe, stay healthy, and wash your hands, because we're all in this together. Thanks, Dr. Weir.
Thanks, Maddy.
See ya.
Take care.